Thank you so much for the presentation. My name is Shareef Alqahtani, and I'm a BGY2 in general surgery. And I did last year a year off to do my MPH in health policy and management. Conferences are great to share thoughts and comments and novel instruments, as you heard, but I want to shift gears to and want to focus on the aspect of health policy and management of patients with breast cancer. I have nothing to disclose, and I'll present a very distinct problem in Saudi Arabia, which is the disadvantaged group who are women above 60 years of age. So just a little bit about the population profile in Saudi. The total population is 29 million. The total fertility rate is about 3.1. The birth rate is 23 per thousand population. Right now, the male to female life expectancy is 74 to 78 years, and the expected population in 2025 is around 40 million. The female population over 60 years of age in Saudi is almost between 6 to 7%, and unfortunately, almost 70% of them are illiterate, which put them on facing many health challenges, and which one of them is cancer screening, not necessarily breast only, but breast, colon, etc. The breast cancer in Saudi Arabia is the most common. It's in every 4 cases of cancer, there is 1 case of breast cancer, usually the presentation in advanced stages. Unfortunately, we do not have a national screening program, and the screening is dependent usually on individual efforts and educational campaigns, which put those women again at facing many challenges in their health. So the objective of my work was to determine whether illiteracy among Saudi women over 60 years of age affect the utilization of breast cancer screening, clinical breast examination and mammography as well. So I looked at the Saudi Elderly National Survey, which is an initiative done by the Ministry of Health, conducted between 2012-2013, and the aim of that survey was to assess the healthcare needs of the elderly citizens. It was a cross-sectional population-based survey. The sample size was calculated for cluster sampling, adjusted for the design effect and non-response as well, and they randomized cross-sectional using probability to proportion to size to selected participants. I did analysis with the Stata 13.1 and with sampling design and weight as well, and I built a logistic regression model with binary outcome, whether if they're doing screening or not, and I adjusted for age, income, region, as well as comorbidities. So out of the surveyed population, there was 1,461 women were eligible for the analysis. 88% of them were illiterate, and the regression multivariate regression showed a statistical significance with a p-value less than 0.05. So this is table 1, participant characteristics. As I mentioned, 88 or more than 88% was illiterate among this cohort, and this is the regression model. And as you see here, the multivariate analysis, the adjusted one, p-value is statistically significant. Just to show you a little bit about the problem currently in Saudi, which is because if there is no national screening program, the probability of breast screening by literacy is very low for both groups, illiterate and non-illiterate, and for illiterate is just 0.08. So with that, I conclude I showed that the illiteracy among Saudi women over 60 years of age may contribute to low level of utilization of breast cancer screening. And it was the first time to prove that illiteracy has a significant effect on women's health in terms of breast cancer specifically, and the health initiatives for women over 60 years of age in the country has to put illiteracy in among the important factors to improve, and future studies are needed to assess illiteracy effect not only on breast cancer but on health as well. I'd like to acknowledge the Johns Hopkins Surgery Center for Outcome Research and my advisor, Dr. Melissa Camp, and my sponsor, King Fahd Specialist Hospital in Dammam. Thank you so much. If there is any questions, concerns, or food for thoughts.
Sorry, you don't think that illiteracy is dependent on the lower socioeconomic situation, so isn't it by itself a dependent factor? So especially from the lower socioeconomic group, they are more literate and they have more attention to their health, so they do less screening.
That's right. I think it's a factor, but if you looked at the monthly income for most of the Saudis is above almost 1,000 US dollar. So I don't think so that is a factor, but the education level as well as the availability of the program itself. I did not, but
that could be one good thing to look upon.
That's right. That's right. My primary focus on research is looking to the health policy management stuff. I could use this point in the future, but there are a lot of social issues in Saudi for women above 60 years of age specifically, and we should do something about that.
And did you try to look younger population and see what happens with respect to literacy there?
Sorry, the what?
In the younger population who are more open and...
The younger right since 2000, every girl or son has to go to school by age of 6. It's a law right now in Saudi. So most women below 35 years old are educated and at least they're high school qualified. Yeah.